I'm the mental elf, and welcome to the CAMHS Campfire. Pull up a toadstool, sit yourself down. It's nice and warm around the campfire. We're going to have a chat. We're talking today about self-harm and schools, and specifically a piece of research looking at support tools for staff in schools. Please do join in the conversation on the Zoom chat. So everybody here in the webinar who you can see on the screen is a panelist, and I'll introduce these lovely people in a second. All you guys who are watching are attendees. We can't see you, we can't hear you, but we can see the messages that you post in the chat. So if you haven't already, please do introduce yourself in there and choose the panelists and attendees little blue button when you post so that everybody in the meeting can see who you are and what you're saying. These meetings are really informal, but we always have loads of great conversations going on in the chat. So please do join in with that. Everything will be saved afterwards and shared on the ACAM webpage. And there's a link to that already in the chat, and we'll post it again later on. So all the slides, the video, all that kind of stuff will be saved. So you don't need to worry about losing any of that. So let me introduce everyone. First of all, we've got a really great group of people here today. We have Alicia. Give us a wave, Alicia. Hi. Alicia is a member of the McPin Young People's Network. She has a diagnosis of Asperger's autism, has used CAMHS services in the past, and has suffered with depression for many years as a teenager. She's our lived experience representative this evening. Wonderful to have you here. Thanks very much for joining us. We have Lily Pierre, who's a final year medical student at the University of Cambridge. Hi, Lily. And well, with a big interest in psychiatry, she's starting an academic junior doctor job in London this summer. Congratulations. And Lily's the first author on the paper that we're going to be talking about this evening. We have Jo. Hi, Jo. Dr. Joanna Anderson from the University of Cambridge. She's a senior research associate in the Department of Psychiatry and works in child and adolescent mental health. And we have Mina. Hi, Mina. Dr. Mina from Oxford, Associate Professor in Child Psychiatry at the university there, with an interest in school mental health, works a lot with vulnerable populations. And then we also have my colleagues on the Campfire team, Douglas, my colleague Douglas Badenoch, who is co-founder and director of the National ELF Service, an information scientist. He's got a black belt in critical appraisal skills. He's going to be doing all that kind of stuff this evening. And Celine, Dr. Celine Reichart, who is also here, one of the team organising the event, and she is a clinical lecturer. Hi, Celine, at King's in London. She's going to be moderating the chat this evening, so you'll see some messages from her as we go through. So I'm talking very quickly because we've got loads to cover in the next hour. We're really hoping to get through as much as we can. And we're going to start off just by kind of introducing this topic for you. Talking a bit about self-harm in young people and what schools can do and how we can help staff improve their skills and their knowledge in this area. So we're going to do that for about 15 or 20 minutes, just have a general conversation. Then we're going to get into some critical appraisal, and we're going to look at the piece of research by Lily and Jo that we're focusing on today, and Douglas is going to take us through that. So you'll learn some stuff there about research methodologies and hopefully some stuff that you can take away. And then we're going to finish off by talking about, you know, so what? What should we do now? Now that we've got this research, now that we know this, are there any actions? And, you know, we're, I think, going to touch on some of the kind of practicalities of doing school-based mental health research as part of that conversation, because it's not a straightforward topic to research, and it's not a straightforward place to do research in. So lots of issues there that I think are going to be interesting. So if you've got any questions, do put them in the chat, and we'll try and put those to our panelists as we go along. And I'm going to start by asking Mina, just broadly speaking, Mina, what role do you think schools can play in identifying self-harm in young people? And what support do you think that they can give them?
Good afternoon, everyone, and Andrew in particular. That's a very big question. Before I start, I am going to say I do have a naughty dog in the room that often barks at the wrong time, so apologies for that. And occasional children as well that will wave behind us. So I think we should think about schools as playing a really, really important role. Probably they're not playing quite the role they could play, and that's where learning about it and the science is really, I think, going to help us over the next 10 years or so. So I think the first area that schools play an important role is kind of the drivers of self-harm for young people. Now, there are going to be many of those, but I think it's useful to think about the main ones, which will be around social connectedness and social relationships with young people, be around self-esteem issues, and probably around bullying. They're all interrelated. So schools, the first role schools can play is that they can actually do things in all of those areas that isn't overtly saying we're doing something for self-harm, but it's actually about the school environment that can be dramatically important for a young person who might be at risk of self-harm or contemplating self-harm. If they can build systems in the school to make people feel more connected, possibly with non-academic, unstructured environment as well as the structured environment, building ways to improve your feelings of self-esteem, and then really, if there's bullying in a school, to think of ways to consult with young people and to really take that seriously and address it as a school. So that's first, thinking about the drivers of self-harm, and then secondly, thinking about the young person who might be self-harming or considering self-harm. Well, schools provide a really important opportunity for young people to access adults outside of their family with whom they might be more comfortable talking to. And so either that might be someone they recognise in the school and a teacher, or it might be more formal support. But schools are a place where young people can access those services. And a term that we've used a lot is they democratise access to services. So if you're attending school, you're in a position where you can potentially access these services, which is very different to CAMHS, for example, or formal mental health services where you might need a referral, you might need a parent to take you. So I think those are the main areas, and also for peers. So if you are a young person worried about your friend who might have self-harmed, then it also gives an opportunity and a place for that peer to express concern or ask for advice. So those are some of the, I think, key areas that I think schools can play for young people.
Thank you. That's great. I want to come to Alicia now. I mean, what's your reflection on what Mina said there?
Yeah, I thought it was really interesting because as a young person, you spend so much time, you know, so many hours at school. And if staff are feeling more confident when these situations arise, you know, they'll make you feel less uncomfortable. And I've been in this situation myself, and it really can show when the staff aren't confident, and it can have a knock-on effect. And you might not want to go again to chat to them about that situation. But if you're both feeling confident, you might want to next time, or like you said, Mina, about a friend even.
How well do you think schools do currently, Alicia, at that in your experience? Speaking to, you know, your own experience and speaking to friends, do you think that's something that's well dealt with in schools? Do you think teachers feel confident, or do you think that's something that we need to work hard on?
I've had a good experience and a bad experience. So when I was at school, I was in that situation, and I'd often be sent home and kind of like have to wait for my parent to come, and you're kind of in a no man's land then. But then when I was at college, so like a year up, sixth form level, that the staff there, they had like a college counsellor, which was really helpful because then it was kind of like a named person that you could talk to, and we all had her phone number on our phone, so we could if you were in a lesson, you could be excused for that. And for me, it actually stopped me doing it. And I actually was able to do more days in schools. So it does make a big difference to outcomes for young people.
It's really hard, isn't it? I want to bring in Joe to reflect a bit on this. You know, my sense is that mental health is hard to talk about, you know, period. And self-harm is one of the hardest areas within mental health to talk about. And schools often feel, or staff often feel, so we talk about schools, don't we? People who work in schools often feel, oh my God, I'm really worried about, you know, broaching this subject because I think I might cause more harm than good. What do you think about that? What's schools' view of having these conversations?
Well, first, hello everyone. I'm really happy to be here and thank you for having me. So yes, as you said, I think schools are getting more and more comfortable to talk about mental health in general, but I think when it comes to self-harm, that school staff is still quite uncomfortable when it comes to those conversations. And probably one of the reasons for it is the fear of contagion or fear of putting ideas into young people's heads. And while we know that self-harm could have a social function, so it could be a part of building a group identity or signaling belonging to a group or some way of connecting with peers, we also know that talking about self-harm not necessarily causes people to actually do it. So I think the very important thing is to talk about mental health in general and include self-harm as a part of that discussion, rather than treat it as a standalone topic and only approach it when there is actually a problem. Just building an awareness around self-harm and what are the reasons for it, and how can we help. And as Mina mentioned bullying before, actually, we also know that young people who have a sense of belonging to a peer group or have a social support from their peers are much less likely to self-harm. So I think it's also very important to foster those relationships and to prevent bullying.
Thank you. So we're going to focus on support tools particularly, because that was the subject of the review that you and Lily did. Do you want to give us a bit of an introduction to that, Lily? Do you want to just tell us briefly what support tools are available for school staff, what you found with your review?
Yeah, so hi everybody. So in our review, we included 8 papers and 2 of them were looking at tools. So of those, one was a website and one was a new policy. And the other 6 were looking at workshop kind of interventions and workshops and training courses. And the aim of all of them was to improve school staff's ability to understand, recognize and respond effectively to students who are self-harming. And importantly, it wasn't just teachers, it was a broad range of school staff, so counsellors, nurses, admin staff, etc. And in terms of components of the workshops and training courses, there were various different components. For example, presentations about an overview of self-harm, the epidemiology and the etiology, but also teaching on how to appropriately respond to youth who have engaged in self-harm, how to do a formal risk assessment, and also some role play scenarios where the school staff could practice doing those things. So those were the main interventions that we were looking at.
And I guess because this is a piece of research that you've done, it's a review of other studies that you're bringing together. What you found is support tools that have been researched and published. So there may be support tools that have been researched and not been published that you may not have found. And then there may have been other support tools, maybe the majority of support tools for self-harm in schools that never get published or never get researched. So grey literature, you know, unpublished stuff, or, you know, things that are published in reports or school newsletters or whatever it might be. That's really important, isn't it? I mean, Joe, do you want to give us a bit of a sense of your view of the big picture here?
Yes, we've actually had a look at what's out there as a part of a different project, actually, and there is actually probably more around of the ongoing guidelines or interventions that has never been published, but they've also have not been evaluated. But because some of them were developed by, say, charities, and they've been delivered for quite a long period of time, and they sort of change and being adjusted to respond to needs of the recipients. So different schools, they actually know quite well what is needed, what is well received, and what are the barriers for implementing those interventions as well, how feasible they are for staff, how acceptable. So it's actually quite important to also look at those rather than just research, because the research ones, we don't actually know what happened with them after the study was finished, whether they were sustained, whether the staff is still benefiting from them. So I think it's quite important to look at grey literature as well.
Yeah. So, I mean, that raises all sorts of questions, doesn't it, about academia and the third sector and how we can work together better to do more joined up, you know, real world science. There's 100 questions that I want to ask, but I'm not going to ask them because it's going to derail the whole conversation. So yes, thank you. That's been helpful. So yeah, well, let's move on. Let's talk a bit about the research. Before I pass over to Douglas, I just want to put a quick poll up, if I may. just to kind of get a sense who we've got in the audience. We've got over 200 people now. So just answer this question for us. Just tell us which of these best matches your current role, just so we can get a sense of who we've got in the audience. Okay, thank you, Matt. So, that's great. So we've got 20% of the audience are educational professionals. We've got lots of CAMHS practitioners, lots of psychotherapists and students, a few academics, and a range of other professionals. So yeah, that's a really nice mixed audience. Thanks very much, everyone, for filling that in. So we're gonna talk a bit about the science now. So I'm going to pass over to Douglas, and he's going to talk through the blog that he wrote and some of his reflections, and then we're going to broaden it out again to a more general conversation in about 20 minutes or so. So yeah, Douglas, over to you.
Thank you, Andre. Thanks for having me on another campfire. I'm going to share my screen now, and hopefully that will do the business with the slides. There we go. So we've heard a little bit about how important schools are, or schools can be, and we're going to spend a little bit of time just looking at some of the details of the review, kicking the tires, looking the gift horse in the mouth, all that kind of thing, just to be sure that we're getting the right messages from this study. So when we started to plan for this campfire, I was absolutely delighted because the paper is a systematic review. Which is the first one we've looked at in this series, but I thought I should just briefly give people a quick definition, because with an audience that's very varied, this may be a term that's not familiar to people. So I've put the definition of what a systematic review is on the screen there, but sort of in layman's terms, the way to understand it is, it's a review. So what the researchers have tried to do is find everything that's been written about the subject. And secondly, it's systematic. And what that means is they don't just go looking for the stuff that they agree with. They look for everything, whether or not they agree with it, and then look at the totality of the picture. So you can imagine, if you think that through, that type of study is potentially very, very valuable. Because we're all familiar with the situation of a study gets reported and, well, it's just one study, more research is needed. A systematic review gives you the possibility of getting everything all onto one page and finding a definitive answer. The second really helpful thing about a systematic review is that you can clarify where there isn't an answer, where there are areas that we don't know about, where we need more research. So I think for this particular review, we'll see some examples of both of those benefits. The first thing that we always ask ourselves when we look at a paper is, what is the question that the paper was actually addressing? It's important to do that because sometimes the message can get kind of lost in translation and it can be remembered slightly differently. So what I did here was look at the very useful table 1, I think it is, in the paper, which that gives you a list of all the studies that were included, or rather how the studies were included. So the researchers went looking for studies which involved any school staff that were evaluating education, training or support tools, and which assessed outcomes relevant to people's knowledge, confidence and response when working with children and young people who self-harm. So that kind of gives us a composite question, if you like, that very much matches the topic that we're dealing with today. It's also worth pointing out that they were looking specifically for experimental studies or empirical studies, so studies that carried out an intervention and then followed it up over time to see what happened. not studies that look backwards in time to look at the data. They were prospective studies. So we've done an intervention and then we've done an evaluation. So what's our conclusion when we look at the methods of the review? Well, there's the traditional approach to assessing systematic reviews. There's kind of three broad questions that we need to ask ourselves. The first one is, in their search for all the published evidence, did they find everything? And is there likely to be stuff that that's out there that we didn't find? And one of the great things about this review, I was very impressed with your tables of search strategies. You put an enormous amount of effort into defining ways of searching databases, looking for evidence about training and about education and things like that, which are quite difficult concepts to do a good search on. So it was a very impressive search strategy. Another thing that was good about it was that how you went across not just one domain of databases. You didn't just look at mental health literature, you looked at education literature, social science literature as well. So that's a strength of it. But something we might want to come back to later is, as Andre mentioned, when we discussed the paper earlier in the week, people are doing a lot of these types of interventions, and maybe their reports don't get published. So there's probably a lot of expertise out there that's not getting put into the literature. And I guess a venue such as this are a good way to discuss some of the details around that. The second criterion that we usually apply to systematic reviews is the question of whether they only included good quality research in the review. If you include research that might contain bias, then that might skew your findings in a certain direction. So the reviewers have to take a kind of a rigorous approach to evaluating the studies that they include in the review to make sure it's the best quality stuff. And in this case, there's a number of different ways of doing this using a standard instrument. And they also checked some of their findings to make sure that it wasn't just one reviewer's opinion. So that was good. An example of good practice as well. It's important that that sort of second check is done sort of blind to what the first reviewer decides. So if there's two people looking at the data that they found, they want to make sure that they agree about which ones are relevant and what the quality of that data is. So that's the methods of the review. So we've gathered all the evidence, we've included the best quality stuff that all matches our criteria, and we can skip on now to look at the findings. So we found the review reported 8 different studies, and as we've heard, we've got a really wide range of interventions. We've got websites, there's policies, there's training sessions, there's different modules of planned training sessions, and something brilliant called a whole school initiative. So there's a lot of different things were being assessed in the studies. So for that reason, we can't kind of come up with a one combined result because they're looking at slightly different things. However, I think the key thing we find here is that the interventions, there's evidence here that they improved knowledge and confidence, that they were feasible and acceptable to the staff. And they were all sort of in the same direction. So they were consistent. And that in a systematic review at least gives you some sort of confidence in the result, even though we don't have a kind of overall meta-analysis. The other really important thing I thought was from the qualitative data, which you'd plan to include, and I think that was quite a good approach to not just take the sort of quantitative scores on how much people's knowledge had improved, but also look for the feedback, qualitative feedback that was reported in these studies. And some quite interesting comments there around providing staff with the right support and processes to be able to respond to situations, to tailoring the educational interventions and the training to the particular setting, and involving people from across different professional groups to make sure people are working together effectively. So just I wanted to quickly put a little bit more detail, because I know that a lot of you will be educationalists and will want to know, well, which interventions are being looked at here. So I've just highlighted the sort of central column in that table just to show the wide variety of approaches that were taken. And it's certainly worth, if you want to pursue in a little bit more detail, looking at the details of these, get into the supplementary data that comes with the full text of the paper. That would allow you to just have a look, you know, what sort of things were done in each session. But we've got that table in the blog, so you can explore that at your leisure as well. So, my conclusions were, we have some limitations of the evidence here, because there's just, it's quite a difficult area to study. If you're talking about taking a whole organization or a whole team of staff and training them, and then you're measuring a sort of a proxy outcome, you're measuring their knowledge rather than, you know, those are quite difficult things to assess. So there's some sort of inherent limitations in the evidence that we've spoken about, and there may be potential to expand or to rerun that search strategy, looking at unpublished reports to look at what's done in other sectors. However, as I said before, it seems that, you know, we can affect these proxy outcomes, that people's knowledge, people's confidence in responding to young people, and as Alicia said, that's an important feature for a young person to have confidence in, or to feel that the person they're talking to has confidence and is able to give them the support they need. But I think a kind of final underlying point, if you like, would be that one of the key things is about how we measure the outcomes from whatever we do when we try to change our practice, when we try to improve what we do. It can be difficult to know whether was it your training program that made the difference, or was it something else. It seems to me that the best way to approach this in the research would be to get young people involved in those evaluations, and to work closely with young folk to see what outcomes matter to them, and feed that into how we plan future research. So that was my quick dash through the systematic review. I thought it was a very impressive piece of work, and an extremely valuable rallying point, I think, for folk who are committed to improving things in schools for young folk. And I think there's some important issues that we've raised here. I wonder if they're the extent to which, well, what does the audience think about this? And are there any questions that I haven't picked up that you would like to ask the research team? It's not often you do critical appraisal and the actual researchers are sitting there. So hats off to you for undertaking trial by Zoom. But here's your opportunity to ask. Matt, I was wondering if we could put up the poll around the audience's opinion of whether they agree that this is a valid evidence about self-harm in schools. So just take your time to fill in that, and then we'll come back at the end of the discussion to think about the interpretations of and how, you know, what we're going to do differently as a result of this. Okay, thanks for listening. I hope that was a helpful run through. I'll pass back to Andre now, and then we'll reflect some of those questions to the research team and the other panelists.
I want to give Lily, thanks Douglas, I want to give Lily and Joe a sort of right to reply first of all. Just any comments on what Douglas has said, any things that he's raised that you'd like to respond to?
Sorry. Thank you, Douglas. That was a really kind review. I think kinder than any reviewer ever, probably, when we submitted it. I think the one thing that I would mention is also the descriptions of interventions were quite poor. I don't know, Lily, if you would agree with me, but the two papers that we included were actually PhD dissertations, so they had no choice but to describe it in great detail. And these were really, really detailed, good descriptions. So we actually know what made the difference, what they implemented that led to change. But with other papers, apart from one, we actually don't know very well what was the content of the intervention because it was not included in the paper and we could not get the information from the authors. So that's also probably something to keep in mind.
Yeah, and there was a lack of information about who was actually providing the interventions as well. So in some cases, they explained that it was counsellors or psychologists, but in some of them, it didn't even say who was providing the intervention. So there's a lot of data, lack of data on that.
Thank you. So I love the question from April in the chat. Thank you, April, for cutting through a lot of the researcher speak that's inevitable in these sorts of events. But she says, I was wondering whether any of the interventions were found to be helpful at all. So what do you think? Which are the best interventions for improving staff knowledge and skills around self-harm in schools? Do we know?
I think based on the data we've got here, it's difficult to tell because they all use completely different outcome measures. So only one paper used kind of a standardized validated measure. So it used things like the KSQ, they used 3 different questionnaires, but all of the others sort of made up their own questionnaires using like a 5-point scale. How much did this improve your confidence? But because they all use different questionnaires, it's very difficult to compare them. But all 8 papers did show an improvement in school staff's ability to respond and their personal confidence and their subjective knowledge. So, but it's difficult to compare between them, as I said, because we don't have validated scoring systems to compare between the 8 studies.
What do you think, Mina? Do you want to add anything to that, knowing some of these trials that are in the review?
Like it's very frustrating, isn't it? Because you're like, oh, for God's sake, you know, why has every study done something slightly different and measured it in a completely different way? And why in the world can't we come up with some understanding as a result of all this hard work? So I think that the field is littered with these kind of problems across the board and whatever you look at. I think, you know, the reality is that there are many things that need to be done. So obviously the young person's voice, young people being involved in designing interventions, like this is obviously where we have to be going. But for now, what we're learning is that there seems to be a need and a desire from staff and schools to get more skill in this. And that really will hopefully address what Alicia's telling us. You don't really, as a young kid, want to go to someone who looks a bit uncomfortable and really worried and then doesn't make you feel better for having gone and told them something. Firstly, you're never going to go again. Secondly, all your friends will know that it's been a crap experience as well, you know. So you know, that is one area that needs to be addressed. But I do think that, you know, what we do, how we do it, how we develop it, how we measure it, I think what's going to be happening more, and thank God, is that young people are going to be involved in it. So I'll just tell you one little finding we found from our survey of just kids at schools. It's called the Oxford School Survey. We asked in 2019, so a while ago, you know, do you know who provides mental health support at your school? And about 70 to 80% of young people at school said, yes, we do. And then we said, if you had a mental health problem, an emotional behaviour difficulty, I think we put, would you go to that person at school? And only about 25% said yes. So, you know, one is kind of having what we think is a good idea as an adult to provide for young people. And then there's that whole thing, well, is it acceptable to the young person in the first place? You know, once you've done all this training and you've created this wonderful network and system and a great consulting room, you know, is that what the young people want? Is it acceptable? And we have to start learning about how to ask those questions, how to hear their answers, how to be adaptive in response to that as well. So I think it's, you know, really important questions, but loads more questions need to be asked, and hopefully we'll then be able to do something that's more meaningful and useful for young people as well.
And Alicia, you were nodding a lot when Mina was talking there about the responses from young people in that survey. Do you want to kind of say something here?
Yeah, so I was listening closely and I was thinking, because you have to be honest, like the teachers are there to teach a subject, maybe they're not there to help with that. So some of them might be like, I don't really want to do this. So I think, I don't know, in the future, I'd like to see maybe like a key person that maybe deals with that. So like, even though every staff I feel needs to know how to deal with it when it arises, but having a key person that maybe volunteers themselves and wants to actually be there, that young people can go to, I think that would make a real difference. And also on the point of about the research and having young people at the forefront of it, about having lots of different young people, because everybody's experience is going to be different and it's not going to be one size fits all. I think that's important to note as well.
Yeah, absolutely. There's been lots of comments in the chat actually about young people with, you know, neurodiverse young people with different kind of backgrounds in terms of being bullied or being abused or having, you know, kind of all sorts of cultural differences. And yeah, I think that's absolutely key. I mean, shout out to the McPin Young People's Network, because I think the group that you're a member of, I think they do that really well, and they're really, you know, tuned in to making sure that the young people that they have in their network are from a really diverse range of backgrounds. I think a lot of other groups could learn from their example. You make a point there about teachers, you know, being teachers and not being expected to being mental health professionals. That's a really great point. I accidentally posted Darren's comment on question into the chat earlier because I thought it was such a good question. Do we expect teachers to be able to manage all situations, mental health, safeguarding, etc., on top of teaching? Or are we expecting more from schools as places where children can see, you know, receive this kind of multidisciplinary support? Joe, do you want to say something in response to that? You know, what's happened in school-based mental health over the last couple of years? Things have changed quite a bit, haven't they?
Yeah, I think with the government's expectation that school would take more responsibility for identification and also for addressing some mental health difficulties. But I think what is really, really important is to prepare school staff for taking on that role, and also not expecting, as you said, that they're going to become mental health professionals. So equipping them definitely with some level of skills, but also sort of showing them how to refer young people, and there being more collaboration between schools and services as well. So there is no, you know, people bouncing back and forth between the school and the mental health services. Because they don't want to accept some referrals or not able to accept some referrals. So there are a clear pathway to actually where to signpost those young people and they can actually receive help. And I also think, as Alicia said, that any sort of programs, interventions for the school staff, even though they are directed at the school staff, should start from the conversation with young people and actually finding out what are their expectations in terms of school response and what would be helpful for them and what they need. Because we are actually finding out that staff and young people have very different ideas of what would be helpful and what they should be doing. So because the young people are ultimately the recipients, I think they should have the final say of what is important.
So are there examples of services in schools where that's happened, where we have co-produced something and young people have driven it, where we've actually got something that works? Or are we still in such early days that we don't yet have an example of what works well?
I think this is the approach that underpins our work. So our group at Cambridge, we are trying to involve young people with all the interventions that we are developing, including the one that we are looking to develop for school staff to better respond to self-harm. But I don't know if there is a very common approach. I think Mina may know more about that. Sorry, Mina, that I kind of...
I think a lot of the interventions that are being developed right now are incorporating young people's voices much better. So I think that, you know, we have learned and we are doing it. Do we have any good interventions? I think from North America, there are some very interesting interventions that are being developed in that model, but we don't really have great transfer from North America into the UK environment when it comes to intervention. So I think in the UK, this is still an area that we're going to be developing more, but there aren't at this moment, Andre, great interventions. I say, look, for X do this, for Y do that. No, what we do know is we need a whole school understanding and approach and thinking about the drivers.
Yeah. that might not be very well reported also in publications that might be developed with participation of young people. I think in Australia, actually, where they developed the participatory design approach to developing interventions that would be directed at young people, but the young people are a very important, they're co-producing the intervention and co-develop it rather than just lend their views. So I think this is a really useful approach.
And we've had quite a few comments and questions about specific groups of young people with autism, with neurodevelopmental conditions, young people who've got particular experience of abuse or, you know, domestic violence. I wonder, I mean, it feels like if we don't even know what works for all young people, then it's unlikely that we're going to know what works for specific groups. But are we developing interventions in that way where we are thinking about everyone, or are we really focusing on the middle ground here? You know, you're shaking your head, Mina.
My reading is, I think in a way with these other important populations are globally ignored when it comes to the intervention world. So I think that the learning right now is really taking place in the kind of mainstream context, because such massive numbers within that context are suffering from anxiety and depression and self-harm, but there is very important pockets that I think are being ignored, and I don't think what we're learning and developing necessarily has relevance or kind of efficacy in these other groups. So I do think it's important for us always to be aware of what we're not looking at as well as what we are looking at.
Yeah, absolutely. And if we're still very early on in developing these interventions, then now is the time to think of those populations rather than in 10 years' time when people are banging on about it, still banging on about it. Lots of comments as well about age of intervention. People asking about, you know, intervening early in primary schools. What's the kind of science showing us there? Are these all secondary school interventions, or are they looking at earlier age groups as well?
I think they are majorly secondary school interventions. I think I have not actually come across any intervention that would be for younger ages. And the same looking at interventions developed for young people who are at the risk of self-harm or self-harming. That is predominantly, well, probably all of them, secondary schools. I have not seen anything for younger age groups. Because I think until recently it wasn't very much talked about that that younger children may actually self-harm as well. So that could be one of the reasons why.
Yeah, absolutely. So I'm going to go around all four of you now and just ask you to kind of give some ideas about what you think schools should be doing, your kind of top tips for supporting young people who self-harm. And I guess, you know, the preventing of it as well as the helping people who are doing it. Alicia, what would you say, first of all? What do you think schools can do? You're just muted at the moment.
Sorry. Yeah, so I think that obviously compassion, like when they're actually in the situation, is vital. But from the research, from a young person's perspective, I feel like there wasn't any young people's whether they found the interventions that I know the staff said they found it helpful, but whether the young people actually found it helpful at all, which is really important because they might not have found it helpful at all, even though staff said that they did. And just involve young people more in, I guess, going forward with that. Yeah.
How do you think the school environment itself could change to be better for young people who are struggling with mental health issues, who might then go on to self-harm?
I guess it's that thing about just making people more aware of it, that they have somewhere that they can go if they feel that they might do it, or if they have already done it, and a non-judgmental space, and maybe making it more known between peers as well is important. I guess in the E-Day, and just breaking the taboo down and the stigma down generally, I think, is helpful.
And Lily, you're probably next closest to being at school, so I'm going to going in order of people that have got some experience of actually being firsthand in schools themselves. What do you think? Because it's been like 30 years since I've been in a school, and I've no idea how they are now. What do you think needs to change? What do you think has changed? Do you think the school environment has gotten worse over the last 10 years, or what's your sense of how we can make the educational space better for young people with mental health issues?
I think it ties back to what Alicia was saying earlier, in that I think it's useful for all teachers and all school staff to have an understanding of mental health difficulties and self-harm in young people. But I think ultimately, if you have a point person who is the lead for mental health, and you know that's someone you can approach, and that's someone who's going to be more knowledgeable and hopefully more trustworthy and able to set you up with the right services and resources, I think that would be particularly helpful. And I don't know if that's the case in all schools, that they have, you know, a point person, and that it's part of a known policy that alters that point person with the student's permission if they're struggling. So I think that would be really helpful.
Yeah. And Joe, you said earlier that, you know, we know that talking about self-harm and talking about suicide doesn't increase self-harm and suicide. So that's one like really clear, you know, bursting that kind of misinformation bubble. What else is there in that sense? What other top tips would you give to schools?
Yeah, I think, as you said, don't be scared to talk about self-harm. Don't be scared to talk about mental health, because the more we talk about it, the more acceptable topic it becomes. So that would encourage young people to come forward, and to hopefully that would reduce stigma. Also, I would say school staff get their hands on any training that is available, because something is always better than nothing. And there are actually some resources available online that I think you've put in the resource list. The one developed by Oxford University together with Charlie Waller. It is quite comprehensive, and I would say just look at anything that is available, and also look at the broader mental health in school, foster a culture where mental health is important to everyone, not just focus on the results assessment, but also on the well-being of students. I think this is very important.
And do you want to add, Mina, in terms of school leaders and people in more kind of senior educational positions, what do you think they can do?
Well, I think it's just not to underestimate what Joe is ending up talking about, and what you asked about the school environment. Like, actually being a good school with lots of possible activities that can cater to the whole breadth of kids in your school. You know, you've got clubs where, you know, where you can meet kids in other years, where you can build your friendships across different age groups, where you can learn, you know, you feel less lonely, you feel a sense of belonging to the school, you build your self-esteem. Like, all of these are going to have incredibly important impacts for the mental well-being of the children, as well as just their broader education. So, you know, it is an overwhelming need and overwhelming feeling for these educators to think, oh my gosh, we're now responsible for the mental health of all the kids as well as all their education. But I honestly think, like, you know, being a good teacher and, you know, encouraging your students is actually going to be phenomenally valuable in their mental health needs. So I think that, you know, not to underestimate the role of all these other things that take place in schools. So I often say to teachers, you know, you have the most powerful mental health interventions at your fingertips. You just don't know it. And I have none of them at my fingertips. So I can't take children and put them in a group with some other kids and, you know, not even, you know, pretend, well, why don't you, you know, I'm going to split the class into these 4 groups. So you've got to do a project like that. And you can take a vulnerable kid without them knowing, put them with the kids that you think will support them. Like, these are interventions that I could never do in a clinic away from a school, but this could be all that's needed to facilitate a young kid feeling less lonely, feeling it might be worth, giving them a bit of motivation and shifting the balance for them. So just to be aware that this is, I suppose, a really important mental health environment, whether or not you like it, you know, that is the reality of what it is. So let's find ways to enhance it and build it as well.
That's a really nice message. That's such a positive message for teachers who I think really struggle with these kinds of conversations. You know, being a great teacher, being a lovely teacher, and being great at circle time and all that kind of stuff is actually the thing that you can do most of all that's going to help. What about COVID? now? What about what's affecting young people now, having gone back to school, still working through what's going on nationally? What impact is that having on education? Do you want to say something on that as well, Mina?
Well, I think, you know, it is, as we all know, a really complicated time. And I think we just need to tread carefully, be careful. You know, I read in the news about this school that just got rid of all lessons for a week and was just going outside into bushes. You know, like, actually, I was like, oh, thank God, that's the right message. Like, I don't care about academic attainment. I care about these kind of things. So I think, you know, what we have to realize is that children have had very mixed experiences out of school. Some have really thrived out of school. Some have found it very, very difficult. And so we need to say, you know, step back and think, well, what does that tell us about our system? What does that tell us about different needs? But I think we have to be aware that, especially for young people at a time where they're learning about their independence, that it's just been completely robbed from them, where they want to spend more time with their peers and ignore their families because their brains are somewhat telling them that's what they need to do. They're not able to express that. So, you know, just to, I suppose, just be aware of how fragmented the world has become for a lot of these young people, how they, you know, that this is just a time where they need a bit of help to build their relationships, to learn how to interact better with one another, to not be so reliant on, you know, social media. It might have been a great thing for most of them, but how can we take the step back into the real world context as well? So I think I'm very hopeful that, you know, things are getting much better now with regards to all these lockdowns. But for young people, I think, you know, messages around, you know, exams and academics, you know, it's been quite difficult for them, and we need to, you know, help everyone understand that the most important thing is just to be able to find a way to settle in again, to work out how to study again, to work out how to interact with your peers again, and that's all going to take time. And don't worry if you're young and it just doesn't feel right or it's really difficult. It should be, you know, you've been through quite an atypical time.
It was really telling, wasn't it, looking at the research findings during that first lockdown last year, where they were looking at how it had impacted on young people and families, and showing that primary school kids were struggling and secondary school kids were actually, many of them, much better off in terms of their mental well-being and their behaviour than they had been whilst they were at school. And there's lots of researchers talking about that, saying, well, I'm not sure what this shows about our education system, but it shows quite a lot, doesn't it, I think, about how things need to change in order for mental health to be really promoted in schools, you know, with the education system more widely. So we're kind of coming to a close now. I think we're going to have a little poll just to kind of get a sense from the audience of what you thought of the meeting, whether this was useful. If you'd recommend this kind of journal club to colleagues, let us know. So 1 means you hated it and 10 means you loved it. Tell us what you think. And I want to let you know while you're doing that the next journal club that we're going to have, the next CAMHS Campfire session, is on the 25th of May, and it's going to be looking at ADHD and medication for young people with autism with Steph Amis and Sam Cortese. So that's a really interesting piece of research, and it will be a great discussion as well, I'm sure. And you can check out on the ACAM website all the resources for this meeting today, and the video will be available, I think, probably later on this week for you to watch again. So if you've got colleagues you think might be interested, do let them know.